Thank you very much indeed.
Now, today, the government is unveiling a new plan to help boost emergency care in the NHS, spending a lot of money on it. But some critics say that the measures are simply not enough to ease the pressure on overstretched, understaffed A&E services.
This comes as the Prime Minister sacked the Tory chairman Nadim Zahawi yesterday after that ethics inquiry found he was in serious breach of the ministerial code. So a lot to talk about with the Health Minister, Helen Whately. Very good morning to you.
Good morning.
Let's deal first with what on earth is happening in the NHS, because we still have strikes on the horizon. Nurses feel like they're not being paid enough, neither do ambulance workers. And yet we have a plan of sorts, 5,000 extra hospital beds and 800 extra ambulances. Well, that's good news. The bad news is you've got more than 130,000 vacancies in the NHS. So do you have the staff for those extra beds and ambulances?
Good morning, and thank you for inviting me on to talk about our plan for recovering our emergency care services. Really, really important, because I know that people have been waiting too long, whether it's waiting in A&E or waiting for ambulances, and that can be really worrying. So we want to make sure that that is better in the months ahead. Clearly, there's a huge amount already going on to improve that, including extra funding that's gone into health and social care through this winter. But the plan we're publishing today is about looking ahead, the months ahead, through into next winter and the year beyond that, to really improve urgent and emergency care, to increase the capacity that we've got in hospitals and ambulance services, and with that staffing, of course, and then to do things differently, to reduce some of the pressures on hospitals and to do more to care for people out of hospital, which is often better for patients, as well as clearly leaving the space in hospital for those who need to be there.
My question was, with 130,000 vacancies in the NHS, do you have the staff to look after the people in those extra beds or to be on those ambulances? You have a vacancy rate of nurses, 47,000 nurse vacancies. That's the highest number on record.
So, yes, when we say that there's going to be 5,000 more beds, that's staff beds and 800 new ambulances, and that's staffed ambulances.
Where are you bringing up these staff from with 47,000 nurse vacancies?
The staff is what matters. The staff are the people who care for you. And so what we're doing is recruiting more doctors, nurses and other health professionals to the NHS all the time. One reason why we've got vacancies is because we're expanding the services and recruiting more. We're on track to have 50,000.
What did you just say? One of the reasons you've got vacancies is because you're recruiting more?
Expand services, clearly you recruit to fill vacancies, but on the point of the numbers of staff, so we're on track to have...
recruiting more staff, but have the highest number of nurse vacancies on record. You're not recruiting enough staff.
If you'll let me finish, we are recruiting and on track to have 50,000 more nurses in the NHS next year compared to 2019, and 35,000 more doctors compared to 2010, along with many more support staff, important staff like healthcare assistants and supporting paramedics, emergency medical technicians. So extra staff at the front line so that we can have those extra 5,000 beds, 800 new ambulances, and also care for more people out of hospital. That's really important. That depends on community health teams and also investment in social care that we're making. So at the autumn statement, we announced up to 7.5 billion more funding for social care. That's a record funding settlement. That includes being able to have more staff working in social care and looking after people in their own homes, for instance, which is so important to help people get home from hospital.
Could you just back up that statement you just made when you said that we are on track to have these tens of thousands of extra nurses and extra doctors? We interviewed a very senior doctor practising emergency care this morning, one of the top men in the country, actually, and he was unequivocal. He said that there is no such plan that he's seen for these extra staff to come along, and no sign that they are coming along. So could you just sort of support the statement you just made? How do you know that you're going to get these extra staff?
So I know that things are really tough in emergency departments. I've been visiting emergency departments myself as part of my job as a health minister, and I know how busy they are. In fact, in December, we saw record number of attendances at A&E. Over 2.3 million people went to A&E. So, of course, that feels extremely pressured if you're working in that environment as a doctor or a nurse or a paramedic.
I asked you to back up what you just said, and you're not doing that. Can you explain to us why you are confident that these extra staff will come into place next year? Because that's what you said, and I'm just wondering why you've said that, how you can back it up.
So it's a matter of fact that we set out an ambition between 2019 and 2024 to have 50,000 more nurses in the NHS, and we're on track on that. We've got over 45,000 more nurses already since 2019. So we have got those numbers increasing year by year. So that is happening. And though I heard you say that you had a doctor who felt that it wasn't making a difference for him in emergency departments, actually, from some of the conversations I've had on the front line, I have had nurses say to me that actually it's beginning to feel different. I'm not suggesting for a moment that it is easy at all. There's clearly a huge amount of pressure on the NHS, lots of extra demands for those services, but we are recruiting and increasing the number of staff in the health service. But I do want to say, as well as the more, which is really important, having more capacity in the NHS, also doing things differently, because I know that people are worried. They know that people are living longer. This is a good thing, but with more health conditions, that means that people need more healthcare. How's the NHS going to cope in the months and years ahead with that? It's not just about having more doctors and nurses. It's also about doing things differently. So caring for more people out of hospital. We know that around 20% of admissions to hospital aren't actually necessary. Those people would probably be better off not being in hospital if we could make sure that they had the right care at home. So this is one reason.
I think, look, Helen Whately, ambitions to have more staff are very different from actually recruiting more staff, and 133,000 vacancies is going to need a very ambitious plan to fill. But we want to talk to you about someone who's just lost their job, and that is Nadim Zahawi. Why did it take the Prime Minister so long to get rid of someone who clearly hadn't done the right thing?
Well, what the Prime Minister did is he asked his independent ethics advisor, Sir Laurie Magnus, to look into the facts of the case, because clearly he didn't want to make a decision based on allegations, but actually to know what had actually happened. And so Sir Laurie looked into that, and yesterday he set out in his letter to the Prime Minister the facts of the case, and including where Nadim Zahawi had broken the ministerial code. And on receipt of that, the Prime Minister made a very prompt decision to remove Nadim Zahawi from his government.
Although, was it, Minister? Because he stood up in the Commons in Prime Minister's questions and said everything had been resolved. It was after that he then realised that everything wasn't resolved, and he has to ask someone else to investigate it for him.
Do you think Mr Zahawi actually lied to the Prime Minister? When the Prime Minister asked him, well, what's the story here? What is the situation? Were you fined? What happened? Do you think he was misled?
So I don't know what conversations went on between the Prime Minister and Nadim Zahawi directly like that. What I do know is that the Prime Minister is committed to having integrity, accountability and professionalism in his government. And he asked the independent ethics advisor to look into the facts of the case. So that's the right thing to do, not for the Prime Minister personally to be going through the records, but for somebody who's independent of government to look through that and to set out his conclusions, which, if you look at the letter from Sir Laurie, he did very, very clearly, setting out where Nadim Zahawi had opportunities and where he indeed should have declared about his tax situation, but didn't. And that was the basis on which the Prime Minister removed Nadim from government.
Do you feel, as many are calling for, some are calling for this morning, that Mr Zahawi should now resign as an MP? Because the inescapable conclusion to all of this, that either he lied by omission, either directly to the Prime Minister or certainly to civil servants, or he directly lied and said that there was nothing going on. What do you think?
I think what Nadim Zahawi does next is clearly a decision for Nadim. My own view as a minister is that the ministerial code is clearly extremely important and we should be following it. I should follow it as an individual. I should make sure that I don't have any conflicts of interest or perceived conflicts of interest and declare all those things through register of interest. And I think every minister should take this responsibility very, very seriously. It's a huge privilege being a member of the government. You take that very seriously. I devote my time to making sure that we are doing better in health and social care. The plans, for instance, that we're talking about today, I want to make sure that people get the health and social care they need. But I know in order to do that job as a minister, I have to make sure that I follow all the right processes and transparent as well.
Well, look, thank you very much for your time. By the way, to our viewers, that wasn't bacon and eggs crackling in the background. That was a slight crackle on your microphone, but we could hear every word you said, so it's not a problem.
Helen Whately, thanks very much.
Thanks very much indeed. 8:37 now.